right, so at this time, it's my pleasure to introduce Ms. Kelly Kraus. Kelly grew up in Ormond Beach, Florida. She holds an undergraduate degree in health sciences and communications from Furman University and a master's degree in counseling and psychology from Regis University. She is a licensed mental health counselor. Kelly worked in the Division of Youth Corrections in Denver, Colorado early in her career, where she discovered her passion for mental health counseling. Kelly served as the individual and group counselor in a subacute care unit for children and adolescents experiencing crisis before moving back into her hometown. She worked as the outpatient mental health therapist for SMA Healthcare in Flagler County in 2017, interacting primarily with clients with severe and persistent mental illnesses. In September 2020, she accepted a position as the Director of Outpatient Services in Flagler County, where she hopes to help to improve access and availability to mental health and substance abuse services for the residents. So at this time, it's my pleasure to officially introduce Kelly Kraus.
Good morning. Thank you so much. I'm glad you all are here. This presentation on telehealth is very timely considering the pandemic that we're experiencing. SMA, where I work, actually started doing telehealth before the pandemic, so luckily we were set up. We probably had to do a little bit more behind the scenes things that I wouldn't know about because I don't work in that part of it, but we did have the technology. So for some people it might be new, the telehealth. For some people you might have been doing it before all this happened. So we're going to start off with just a few polls, just so I can kind of get a feel from where everyone's starting off with.
So our first poll asks, were you using telehealth prior to COVID-19? And the choices we have are, I was only doing telehealth before COVID-19. I was doing a combination of telehealth and in-person before COVID-19. I was only doing in-person before COVID-19 as the last choice there. And then you don't have to vote too. So if these don't apply, you don't have to cast a vote, but we'd love to hear from you what your situation is right now. So Kelly, it looks like most of the people that are coming on are saying I was only doing in-person before COVID-19. So this is a big change for most people.
Okay.
Okay. So we'll give you one final chance to cast your vote here. Looks like 68% of you were only doing in-person counseling and services. 69, okay. All right, we'll move to the next poll. So the next poll asks, do you prefer telehealth or in-person sessions? As a practitioner, this is. So the first option is I prefer telehealth over in-person sessions. Second one, I prefer sessions over telehealth. And then the last one is I have no preference. Okay, so it looks like we're getting a really strong showing here. About 62% preferring to do the in-health over telehealth.
Okay.
Or in-person, I should say. Which is interesting, because I thought it might even be higher.
Me too. I'm actually surprised by the amount of no preference.
Okay. Moving on to poll number 3. So how comfortable are you with telehealth? So first option is I'm completely comfortable with telehealth. Second option is I'm somewhat comfortable with telehealth. And the third option is I'm not at all comfortable with telehealth. So results are coming in on this one. So this is good. Only, 16, 17% people saying that they're not at all comfortable with it. And then the majority of people saying they're somewhat.
Nice. And there's a good amount who are completely, which is great.
Yeah. All right, so maybe at the end, too, we can have some of the people who are completely comfortable type in what are some of your best practices out there so we can all share.
I would love that.
Okay. All right, and our last poll coming up here. Last poll question, do you plan to continue telehealth after the pandemic? And the options are here, I will only do telehealth after the pandemic. I'm going to move and only do in-person, or I'll do a combination of. Okay, so Kelly, it looks like a really strong showing here for the last one, where people are saying they're going to only do it, they're going to actually do a combination.
Nice. Not anyone for only telehealth, but
Yeah.
plenty for combination, which is nice.
And about 20% going back to only doing in person, which is kind of interesting. Okay.
All right.
So I think I'm going to flip back to your presentation now. At least that's a great idea. It gives us an idea of who's here and where they're at in their telehealth journey.
That's great. Let's see if my clicker's working. I don't think so. There we go. Okay. So I'm just going to flip through the polls since we already did those. All right, so as you know, now that I'm seeing that most of us have already had experience with telehealth, we all know there's some pros and cons. I put a little short list here that I'll go through more in detail in the next slides. So one of the pros of telehealth is it's very convenient. Our clients don't have to factor transportation in when they're trying to schedule with us, so they might have more availability. It can kind of make their lives a little bit easier. Clients can participate from their homes, which is very comfortable for some people, and also just not having to drive somewhere if gas money's tight. And then I wrote less no-shows because my personal experience has been that if my client's not in the room 2 minutes, 3 minutes after, I'll just call them. And if they've forgotten, because I do have a lot of forgetful clients, they can just pop on instead of having to reschedule because they don't have to travel. So that's been really nice. Accessibility kind of is a pro or a con depending on the situation. So for some clients who lack transportation, that's a great way to reach them. In Flagler County, we really don't have a reliable public transportation system. We have some workaround options, but a lot of times they're full. You have to schedule them in advance. Clients have to wait a couple hours between transports in the waiting room, and so for some of them it's just more comfortable to just do it through telehealth. So that's a positive there. However, if there's a lack of reliable internet, then it's really not that accessible. So there is a large portion of Flagler County where we have satellite internet only as an option, and that just really doesn't work for telehealth very often. So you have to think about both those things when you're looking at the area you work in and implementing telehealth into your practice. The lack of in-person connection is a big struggle for a lot of people, both clients and the therapists. As therapists, there's unique, or anyone working, if you're not necessarily a therapist, anyone working in the field of mental health and substance abuse, there's some unique challenges that come with adapting the telehealth model. We do use a lot of nonverbal cues such as eye contact, which, you know, now I'm doing this webinar, so my eye contact is looking in a camera instead of into anyone's eyes, and that's the same with telehealth, but also you kind of want to see your client's facial expressions, so you also want to be seeing them on the screen. And we use a lot of just body language, which you do miss the bottom half, as you see. You miss the bottom half usually, so you're not really seeing all the fidgeting that's going on and things like that. If you're using an experiential therapy, you have to be more creative whenever you're doing telehealth because you might not have the means that you're working with, like whether it's play therapy or if you do EMDR, there are ways to do EMDR through the camera. It's a little bit more challenging, especially if you're normally using the tappers or if you're tapping yourself. And group therapy has challenges as well with telehealth. I've noticed, at least in Flagler County, our psychoeducation groups have actually gone pretty well through telehealth because it's a lot more information gathering. But process groups, wherever you want to be interacting with each other and watching your clients interact with each other, or support groups where you really need that support one-on-one, you miss a lot of the chances to interact, and so you have to work on really maybe having smaller groups. Right now my group has just 2 participants and that's working pretty well, but you know, normally I have at least 5, so there's some challenges with that. So confidentiality is always important in any healthcare, mental health as well. We really want our clients to feel comfortable to be able to be open with us, and if they don't feel like it's safe, they won't do that. So there's 2 types of privacy that I want to go over, electronic and physical, and just briefly. So we have the Health Insurance Portability and Accountability Act, HIPAA. During the coronavirus, the Department of Health and Human Services did put out a statement that they'd be a little less strict on giving fines if whatever's happened in good faith, which to me, as a therapist, it's a little broad. It makes me a little nervous. I wouldn't want to rely too much on that, but it is an option if maybe you're in a small private practice, you don't have the resources, and you're not planning to continue with telehealth. you can look a little bit more into that. But it's really important that if you plan to continue telehealth after the pandemic, that you're using a HIPAA-compliant platform. And another way to keep things secure is using a password. So in SMA, we use life-size, and I know Zoom has the option, and I'm sure other telehealth platforms do have this option as well. At SMA, we use the client's birthdays, which is really nice because, one, you don't have to email the password, which would kind of defeat the purpose of having a password. And two, if you've not met this client in person, that's your way of confirming that they are the client that they say they are. So it's a really nice way to do it. And since I'm not a HIPAA expert, I did want to point out that FATA, which is the Florida Alcohol and Drug Abuse Association, is putting on a specific presentation on HIPAA. It's called Professional Boundaries, Confidentiality, and HIPAA with Telehealth Services, and that's going to be on October 28th. So if you want to look at FATA's website and you're more interested in knowing a little bit more about this, that's a great presentation to go to. So physical privacy is another type of privacy that we have to think about when we're working with telehealth. So at SMA, there are some counselors, I believe, who were working from home if they're not still, but I continue to work in the office. I did do a few days at home in the beginning of the pandemic, but if you are a therapist working from home or a mental health care provider working from home, if you have other members in your house, make sure that you have an area that's secluded, private, and hopefully that other people can't hear. Headphones are a great strategy so that at least what the client is saying to you can't be heard by other people. And I would recommend that to clients as well who might not have the privacy at home that they would like as they would have in the office. So headphones are great for that. You also have to think about how there's been a rise in domestic violence during the pandemic. So it might be good, even maybe if it's not a domestic violence situation, to have a code word with your client just so that they can let you know, like, hey, someone in my household's just walking by, so, let's just talk about the weather for a couple minutes and then we can get back into actually what I want to talk about. So that might be a good strategy to come up with a code word for your client just so that they don't have to be like, hey, that thing we're talking about, let's not talk about that because so-and-so might hear. So that's one thing to think about. And with domestic violence, it's just nice to be able to know what's going on in a way since it's not really as safe of an environment as if they were coming to the office. Another thing to think about is, do your clients have children? And if they were coming to your office, would they have brought their children in there? Most of the time, some do, some have to, and I understand that, but most of the time they don't. But you'll see that some clients think that because it's telehealth, oh, it's fine, my kid can just play in the background, but they get distracted. So it's a good time to talk about boundaries and how important it is to give yourself that hour or however long your appointments are just to really focus. And whatever you would have done with your child during your appointment when you came in the office, try to have something set up for them so that you can really focus on your mental health during this hour. So going further into boundaries, working with the population we work with in Flagler County and the severe persistent mental health, but also other types of populations, there's always some boundary issues. However, with telehealth and people being at their home, you'll notice they get a lot more comfortable doing things that they probably would not be doing in the office. So some of the things are not being dressed appropriately. I have a lot of clients who I have to remind them that they do need to wear clothing during telehealth. I can still see them even though they're at home. Using drugs or alcohol while on the screen, things that they would not be doing in the office. So, as a mental health professional, it's really important that we're educating our clients about boundaries. That's a really important part of living a healthy life. So when we're seeing things like that happen, it's really important to call out and address the behavior and provide a better model and some boundary education. Another thing I've noticed, especially with my clients who wear glasses, is they'll be browsing other websites, which some of you might be doing right now during this presentation. So they'll be browsing other websites while they're working with you, and I'll be like, hey, what you looking at? I can see in your glasses that you're scrolling through something. So, just call attention to it, work with it in the moment. It's easy to get distracted, especially because with where we are today in the world, a lot of us are just used to autopilot going on and scrolling through things. They might not even realize they're doing it. So just be aware of that. So I want to talk about the change curve. So this has been adapted from Elizabeth Kubler-Ross's grief work, and it's used a lot in organizations to look at how staff members might adapt to change, like whether it's a change in staffing, a change in your procedures, but you can also look at it in terms of how your clients and yourself might react to a change, such as having to move to telehealth. So there's a couple different phases: denial, frustration, depression, experiment, decision, and integration. And I'll go through each of those individually. Different models have different names for these, so just be aware you might have heard this in a different context. These are just the ones we're going to go with today. So denial is the first stage. So you find out you have to switch to telehealth, whether it's I have a personal health risk that I don't want to have to worry about my health, but I want to continue to work with my clients, or maybe you're working for an agency that switches to telehealth. So denial is going to be the things aren't going to change, so I won't need to use telehealth. Or it could be this change won't affect me. So, okay, I understand I have to use telehealth, but I'm not going to have any issues with it. It's going to be exactly the same as in person. So that's a pretty common first stage. I'll tell you that when SMA started doing telehealth, as somebody who came from a very humanistic graduate school, I was like, oh, well, I'm not going to use that because it's not going to work for me. So that was my first reaction. So I definitely started in denial. The next stage is frustration. So anger in the grief stage, frustration here. So that's why do things have to change? Like, I cannot believe they, whether they as your agency, they as you as the therapist, they as your client, expect me to use telehealth, or I don't like this change. I can't provide quality care, or I can't get quality care with telehealth. That's a common feeling and reaction. It's important to know that, whether you're experiencing that now, whether you went through that in the past, but also you'll probably have clients going through that. It's important to work with that. Be comfortable with your clients being able to express their frustration, because it is frustrating. A lot of times going to their therapy session is one of the few in-person interactions some clients get. So the switch is really hard for them. And I don't want you to be afraid that letting them vent about it or feel their frustration is going to make them not participate anymore and you're going to lose clients. It's important to be able to work through that. It's also a good way to work through some distress tolerance issues, pointing out to your client, I'm noticing that you're really fixated on this, working through accepting it's just where we are right now during this pandemic, or maybe it's just where you are right now until your car gets fixed, kind of depending on the client situation. So it's a good thing you can work with during that stage of change. Depression is the next stage. So that looks like feeling helpless. You or your clients might not look forward to your sessions. You might be kind of relieved when they get canceled or there's no shows. During this time, you'll see a decrease in productivity in staff overall in the model, but in yourself, maybe you're just not seeing as many clients. You're not really pushing to remind them to show up to their sessions the way you would before, or your clients might no-show or cancel more frequently. So during this stage, it's important to really, one, recognize it in yourself and work through it. If you're a mental health professional, using your self-care, using your supervision, using your consulting, make sure that you're really working through this. And also being able to recognize it with clients and help them understand what they're going through and explain it to them and help them work through it. So then we get into the experiment phase. During this phase, we're starting to see an increase in productivity. It's kind of a curve that goes, I'll actually see if my hand goes, yeah, okay. So it's a curve. So we're going back up on the curve now with productivity. So we're beginning to engage. So I got to this stage before the pandemic started. I had some clients move to a different county, but they wanted to stay working with me. So I'm like, all right, I'll do this telehealth thing. We'll see how it goes. So I'll try it. Maybe it'll work if I do it this way. Maybe if I sit in this position, it'll be more comfortable. So that's what's happening in that phase. The next phase is the decision phase. So that's when we've decided to accept the change. So we're feeling more positive about the change, like, oh yeah, actually I'm getting good quality sessions with this telehealth thing. It's really not that different, or I found a way to work within the telehealth that is just as effective. The next phase is integration. So that's when we're integrating this change into our normal routine, so the new normal. So like I said, during those last three phases, our productivity will increase. It'll either go back to where it started or maybe even better. For me, it might have gotten a little better, like I said, because I can just call my clients and have them pop on instead of having to reschedule them all the time. So an example I like to give of integration is if you think about where you started with this mask thing in the beginning, when we were all like, this is really weird, like seeing everyone with masks or wearing a mask. And then what I've noticed, a few people have mentioned this to me, and then it happened to me the other day, is you'll be watching an old TV show and you'll be like, why are all those people gathered together and why aren't they wearing masks? Because now that's the new normal. We're used to social distance, we're used to masks, whereas think about 6 months ago, it was really uncomfortable, really different. So evidence-based practices are really important for insurance companies, for us as ethical providers, and for agencies. We all love the term evidence-based. So I did go look at some evidence for that. So the empirical evidence, I found a meta-analysis study, which for those of us who it's been a while since we did our research methods class, that's a study where they look at a bunch of different studies. So they looked at a ton of different studies on telehealth and its effectiveness, and they used that and they did all the statistics between all those studies, and these are the conclusions they came up with. So what they could say is definitely empirical evidence is that using telehealth improved mental health care in a primary care setting. So in a primary care setting where they had a mental health professional, they definitely saw improved outcomes there. They found it was an effective treatment for depression and anxiety disorders, particularly when using CBT, which is cognitive behavioral therapy. They had improved outcomes where patients have comorbid medical conditions. I didn't bring my glasses today, so I'm squinting. So if they had diabetes, if they had high blood pressure, they were seeing improved outcomes in those as well as mental health whenever they were using telehealth. And they saw an increase in medication adherence and compliance when using telehealth within any type of medical setting. So they did a couple different studies over a couple different ways of using telehealth for mental health. And these are the conclusions that they were able to say definitely they were seeing trends with. So creating a physical comfort zone is really important if we're using telehealth regularly. Even if you're only using it once a week, it's still nice to feel comfortable. So one of the things that is really important if you're using it with a client and you want them to feel comfortable is not just holding a phone in front of your face and having them see like the top of your face. I know some clients have no other option but to do that. Sometimes I get a little dizzy, but that's okay. But as therapists and as professionals, since we are doing this in a professional setting, we should have a more professional way to do it. So they do sell, if you have to use your phone, they do sell stands that you can set your phone down so you're not moving too much. They have different stands for laptops, so you're not always looking down at your clients, so you can put your laptop up a little bit higher. The way SMA has set up at least my camera, and I think a couple others in the offices that I've seen, it's been great because it's above the computer. They have backgrounds for some of us to use that have the nice SMA logo if you don't have a nice background in your office or if you're working from home, so that's been nice too. You just want to make sure your telehealth office, we'll call it, is as comfortable as coming in person. So, and I would also suggest you have your clients do the same thing so that they do feel comfortable. Maybe they're not sitting where they sit if they're adolescents and kids who are in school during the classroom day, so they're not associating it with that, or work day if they're adults. So, and then I'm going to end talking about engagement, because I think that's the most important thing that we have some challenges with switching to telehealth. So with engagement, there are some generational differences. However, I did do an informal poll with my other therapists, and I did find that there were no consistent patterns with age groups on who preferred telehealth, who preferred in-person, who they were having the most struggles with. But there are some considerations we want to think about. So the first consideration is the older generation and some technological difficulties. They might not be as comfortable as some of our younger clients who grew up with the technology, or if they're just not the type of person who works a lot with technology, then you might have to schedule a little bit of extra time for troubleshooting. What we used to do before the pandemic was when we were trying to integrate telehealth into our regular practice is we would do a practice session with our clients in the office. So we'd have them bring their computer, bring their phone, usually it's the phone, and we'd have them help them download the life-size app, which is what we use, or Zoom if you use Zoom or whatever app you use. And then we would do a run-through, we'd send them a practice link, and we'd do a practice session in the office so that we know that they're comfortable with it. but it's still good to have maybe a little cushion of time to help them figure out, oh, am I on mute? I had a full session yesterday where I don't know what happened. It was a teenager too, so you'd think he'd be able to fix it, but he could not get his sound to work. So we had to basically do the camera with life size and do the phone for our sound. It was very interesting. With adolescents and children, they might need a more interactive approach, so it might be difficult to get them to sit in front of a computer screen or sit on the phone, which I know we're moving away from the phone now for a little bit. The insurance companies were more lenient with that. But they might need a more interactive approach. So how can you get them engaged and keep them focused and interested in the session when they're sitting, usually either they're sitting through school all day, so this is always a challenge with kids even in the office, but now that a lot of kids are doing school through the internet and they're sitting at the computer all day anyways, they're really struggling to sit through another thing on the computer. Another issue you might have is self-image concerns. So right now, I'm looking at myself. A lot of times in telehealth, we look at ourselves during the session because there's always a little box. I noticed I had a client in the beginning of this pandemic when I started doing telehealth that she would cancel a lot, or she would say her computer wasn't working or her camera wasn't working. And then finally it came out that she just hates looking at herself. And so she would cancel her sessions. So we worked with that. First of all, with life size, because I know there's a lot of SMA people in here, there is a way to get rid of that little in-person screen. There's at least when you're on the computer, there's a little arrow. I'm not sure how to do it on the phone, but I'm sure somebody has figured that one out. In Zoom, you can pin the person. So I have some therapist friends who said they tell their clients to pin them so that they can see them and that other pop-ups don't get in the way and they're not staring at themselves the whole time. You know, as therapists, a lot of us or mental health professionals had to videotape ourselves in graduate school. So we got used to seeing ourselves practice, but now it might be a little distracting to have to stare at yourself and critique your body language and your facial expressions like we had to do in graduate school. So it's nice to be able to turn that off. But also, if your client has self-image concerns, using the share screen and actually working with that in terms of doing some mirror work, doing some self-esteem work, that's a good issue that you can work with telehealth. So another important population we want to engage is families and support systems. So in all the time working with mental health, we want our clients to have good support systems. If it's their family, great. If it's not their family, whoever it is, we really want that. With children and adolescents, parent and guardian engagement is always important, but you might lose some of that in telehealth because they're not dropping their kid off at the office or you're not going to their home, so you're not having that before and after session interaction that you would have if you were doing a one-on-one with their child. So it's really important to either have them come to talk to you in the beginning or the end of the session. Just make sure you're keeping engaged with them and helping them really understand how to help their child or themselves if they're having some stress with parenting, which I want to get into caretaker stress also. So whether it's parents of your clients, whether it's your clients themselves who are caretakers or just caretakers of your clients, caretaker stress is always really challenging for people, but during the pandemic, it's a lot more challenging. We're losing a lot of resources, like maybe their child or their person they were caretaking for went to like a day center or did some activities regularly that have been canceled. Or maybe they have some medical conditions that they don't want their person they're caretaking for to have to stress about, so they themselves can't go out as much. They might have to be ordering in more and staying at home. So the stress levels are a lot higher right now. So it's really important to be talking about that, bringing that to everyone's attention, and just making sure that our clients are staying engaged with their support systems. I noticed in the beginning of the pandemic, and even now, for those of our clients who go to 12-step meetings or other support groups, a lot of them weren't meeting in person, and that was really challenging for some people. So I really encouraged my clients who lost that connection to make their phone calls as often as they could. Call somebody from your group, call your sponsor, keep in contact with people. I know it feels weird because it's not something you would do otherwise, but you losing contact with your support system is not what you need right now. Right now we need more support, not less. And we have the technology now to do, we can use our telehealth technologies to just interact with other people without it being telehealth in terms of the things like Zoom that's more accessible to everyone, FaceTime, Skype, things like that. Really encouraging the people to engage with their support system. And we as therapists really need our support systems right now too, or other mental health professionals. We're all going through this shared trauma together, and we all really need to be patient and kind with ourselves and understanding that this is a change, whether it's the telehealth or whether it's I can't leave my house and I can't do this activity I used to do. Really check in with yourself and make sure that you are still interacting with your support system in the way that best supports you in your own self-care so that you can do the best for your clients. So some other strategies for clients who are struggling to engage, I just wanted to go over some ideas. I got one from myself. I did calculate that I've done about now 500 hours of telehealth in the past 6 months because before I took the new job, I was the full-time mental health therapist. So I have at least 500 hours of experience and more because I was doing it before that as well. So I have some ideas, but I also talked to a lot of my other therapist friends, and I wanted to get their ideas as well. I do have some really great friends from graduate school who are play therapists, so I got some great strategies from them. So one of my play therapist friends, she told me that what she does is she shows the children around her playroom that one day they'll be going to once they're able to. She'll have them bring their play items to session if they have them, depending on the resources. And then she'll use the technology as a way to engage the children. So there are things you can do, whether it's Zoom or Life-Size, or I'm not sure about other platforms, I haven't used them, but I'm sure that they're working on these types of things if they don't already have them. We have a whiteboard where we can draw things with and for our clients. So I know one of my therapists, Rhonda, who I think is watching, she uses that to fill in the sentences. She'll do a sentence starter and then she'll have the client finish it. So I am, and then have the client pick an adjective about themselves. So that's a really useful way. For kids, when you're working with power and control in terms of play therapy, that's a way for them to feel a little bit more in control. They can move the screen, they can move the mouse, they have some control in the session as well. My play therapist friends have also used things like using scavenger hunts as a way to get the kid to work on a specific issue. So show me the things in your house that make you feel safe. Show me the things in your house that make you feel happy, scared, things like that. So you can move around with the camera, especially if they're using a laptop or a phone. And mindfulness is another great way to work with not only kids, but adults. So if we're all getting tired of staring at a computer screen, using our 5 senses, and this is always great in therapy, even if we're not staring at the computer screen, but I think it's especially important during telehealth to just kind of use some grounding techniques using your sense of sight, taste, smell. What can you feel right now where you're sitting? What things can you see in the room around you? What things do you see in my screen? Just kind of bringing them back to the present, but also helping them to just not be so overwhelmed with just staring at technology all day and getting more in touch with the physical world around them. So those are some strategies we've used. If you're using EMDR, if you're trained in that, you can do the virtual eye movements, which EMDR is eye movement desensitization reprocessing. That's a little challenging because some camera lenses are curved, but I do know some therapists who do that. There's some great websites that will do the bilateral movements for the eyes that you can connect with your platform. So you can look into that. You can have your clients do their own tapping, the back and forth. And even if you're not doing EMDR, just doing the butterfly tap, which is this tap right here, is a good way to work through some anxiety, kind of get them grounded. And so there's a lot of physical things you can bring into the sessions. And then I want to give time for questions, so I'm just going to finish up with other considerations. So some things to think about are reimbursement from insurance if you're working with insurance. If you work for an agency, I'm sure you have a lovely billing department like we have at SMA, which I ask them a million questions all the time. So they're the ones who keep me in line with what's okay and what's not. But if you're private practice or you're doing your own billing, just make sure you're working with the communicating with your insurance companies and make sure that if you're doing telehealth and they don't bill for it, you really can't bill for that. So work with that. For those of us who got into mental health thinking we were going to be sitting in an office with patients and clients and not staring at a screen all day, our eyes are probably hurting. My eyes I think I need to go to the eye doctor. I think I probably need to get a new prescription after this whole pandemic, but eye protection is important. There are blue light glasses that will block out some of those rays, and a lot of different companies have come out with them since the pandemic started, maybe before that. I just wasn't that aware before that. So that's something to look into, just making sure you're taking care of your eyes, because staring at a screen all day can be really draining for them, and straining and draining. And then another thing to consider is your ethical conduct guidelines, depending on your profession. So whether you're with the APA for psychology or NBCC for mental health, or if you're marriage and family or social work, each of those practices, they have their own ethical conducts regarding telehealth, and they're very easy to find on all their websites. I looked at all of them. They're all similar, have some differences, but it's important that we are working within our own licensures or our own practices and following the ethical guidelines of our professions. So those are just some other things to consider when using telehealth. So I'm gonna give the last 15 minutes for questions if anyone has some. Did we have any yet?
None that came across yet.
Okay.
There we go. All right, so we didn't have any questions yet, but we see people are typing in.
Yay.
So we actually got a comment here from Maria, who said, I noticed a few days I teleworked, I struggled with being a little drained because I usually de-stress at home, but I was getting stressed at the place I used to de-stress.
Mm-hmm.
Do you have any suggestions for anyone struggling like I did?
My suggestion for that is find a place, if you're working from home, find a place in your home to make your home therapy office that you can just associate that with work, so that you have the rest of your home to be your home. And that's kind of when I was going into the comfort space. Maybe decorate it like you would decorate your office if you were working from an office. And if you're going to be doing it for a while, then it's good to really put some energy into that and have that just be the space where you work and not hang out there. So that's my suggestion.
All right, Amy says, excellent presentation, very helpful. Melinda asks, what is the best strategy you have used for keeping clients engaged?
I think for me the best strategy is just pointing out the here. I'm very humanistic. I like to work client-centered, so every client's different, right? But using the here and now. So I noticed, like, for example, if they have pets who are walking through the screen and they're letting their pets just kind of stand in the screen, I'll do some, hey, are you going to set a boundary with your pet? And we'll work through boundaries in the here and now, just kind of staying in the here and now. Oh, I noticed that you got a new couch, just pointing out the things around them so that they're present. That's what I think works best, at least within my theory of how I work and with my clients.
Okay. Got a thank you from Ada Rodriguez. And I guess one of the questions I had in my mind, my dad's actually a mental health therapist, and he's talking to me about telehealth because it's kind of changed the way he's worked, and he's worked in the industry for over 40 years. And he said one of his challenges was that he'd have some clients with privacy issues. And so they would be in marriage counseling, for instance, or personal counseling that involved their marriage. And so they couldn't find a quiet spot in the house to actually discuss their issues. And so some of his clients were actually doing telehealth sessions from their car. So I don't know if what kind of strategies can people use if they have some personal issues and there are people around when they're trying to do their session?
So I have experienced the exact same thing. Obviously, safety-wise, we don't want to be having our clients drive while they're doing telehealth, but I do have a couple I work with where sometimes they will go sit in the car with the air conditioning on and do their session through there. That's why I like to talk with them early on about, is there a time when your spouse is maybe going to pick the kids up from school, maybe going to be running errands? That would be a great time. If your kids are napping, maybe have your spouse run some errands during that time. That's a great time to do it. If that's possible, sometimes it's just not, and that's why I think the code word can be helpful. Like, oh, I think so-and-so's around the corner. I do work with a couple, and the wife did tell me one time during session, oh, I listened in on his session the other day. I was like, don't do that. That's not good boundaries. So it is definitely a challenge, and it's something that you have to work with each individual client on what their options are.
Okay, that's a great answer. One of the things that I know that people struggle with is, like you said, the self-consciousness of being on camera, and especially sometimes, I know I open my phone up and it's like low on me. I'm like, oh my gosh. And so it is kind of intimidating. What do you think about people that might request to say, hey, can I just knock my camera out and can I just do this on audio? Is that an option for them, or does that cut so much of the interaction down with them in your mind?
I think it's not recommended for a couple reasons. One is insurance companies don't like to fund phone sessions. So that's part of the reason. I have done phone sessions, especially in the beginning when there really was no other option, but I do think you miss a lot of context clues, and it's probably a good thing to work through. Like, okay, you don't want to see yourself. How can you still be on camera so I can see you where you're not focusing on yourself, or why don't you want to see yourself, and let's work through that. So I wouldn't recommend it. I think sometimes you have no other option, but if you can work through that, I would suggest you try to do that.
Okay. And have any of your clients expressed kind of a worry that since they're on a digital platform that now this can be recorded? When you're in the office with somebody and you're having a conversation that's naturally flowing and you don't think about anybody recording you because it would have to take extra steps to do so, right? But I know with today's technology, is that anything that clients are paranoid, or has no one brought that up?
I've had it brought up twice, except one of them wanted it recorded, and he was experiencing some paranoia, and we don't record our sessions, so we had to work through why do you want it recorded, what's the trust issue there. And then I've had another client just ask, and I just have been like, we don't record that is not how we work, that's not HIPAA. But I haven't had to go too in detail about it. I think if clients were really worried, I'd have to get some more information from my health information management team about exactly why that wouldn't work, because some people might need those details. I don't know specifically why it doesn't technologically work. I know why we don't do it ethically. So it just depends on where the client's coming from. A lot of times that's where I'll work through, it sounds like you're having some trust issues, and try to go into that usually more so. It's usually not about the actual concern about being recorded as it is about some kind of trust issue. So,
okay.
So there's just depending on the client, there's different ways to handle that.
Okay. And we'll give a chance. I don't want to dominate this. I just wanted to, now that we had a chance to have an expert here, and I wanted to be able to tap all of her knowledge. So I asked a few personal questions, but I really want to get questions from the audience. If you have any, please feel free to type some in. Even if you have a best practice that you're using, this webinar is all about sharing ideas and thoughts. So we'd love to hear what you're doing. And in the meantime, while people are having a chance to type in, I want to take the quick opportunity to remind them that if you look just to, I guess it is to the right of our video screen here at the top, you see SMA Telehealth presentation October 23rd. If you click on that, you can actually download a copy of the presentation, and that'll go straight to your computer. The other thing beneath that, we have a link to the CEU request form that we talked about earlier. If you're looking to get CEU credits, you need to fill out that form for sure. We need a form for each different session that you're attending, because this is a 3-part webinar series, the 3rd part of this series. And then we also have an evaluation form on this session. Love to hear your thoughts about what you liked about the session, what you didn't like, as well as ideas for future webinars that you might want to see, or future topics in any of the SMA events that it does. And then the last thing, we have a link here to the SMA Healthcare Foundation. So let's see, so we're getting a lot of thank yous, very helpful, thank you.
Another thing I thought of while we were talking is I do use my screen share option a lot to use, if I'm working through a workbook maybe, like that we would be doing in person, you can put it up on the screen share, but I use the Ekman's Atlas of Emotion website. It's a really cool website that goes through all the different emotions. It's what the movie Inside Out, that's the theory they based it on. So it gives you all the main primary emotions and intensities of it and different reactions, and it's a good way to do some emotion psychoeducation for clients who maybe aren't as self-aware of their own emotions. So that's another strategy you can use with telehealth.
Okay.
Or in the office, but it's nice on telehealth because they're definitely looking at the computer.
And the speaker's name is Kelly Kraus. And Kelly, if you can give me your title and the organization you work for again.
Sure. I'm the Director of Outpatient Services in Flagler County. I work at SMA Healthcare.
Okay. And let's see, a question came in from Veronica. What strategies do you have for maintaining eye contact and also being able to take in clients' facial expressions and body language? Which is a great question, because a lot of times when people are doing video, they're trying to look into the camera but at the same, so they can get that sense of intimacy and closeness. But at the same time, then you want to be able to read who you're talking to. So how do you do both of those things?
So, to be honest, I think it's client to client. I would love to hear other people's opinions on this as well in the chat, but I do more of looking at their face rather than looking into the camera. And I've noticed a lot of my clients do the same. So even though it's not what eye contact would be if you were in person, it's not been a huge problem. It seems to work pretty well. Sometimes if I really want my client's attention, then I will look in the camera just to make a point. But usually I'm just looking at their face and they're looking at my face, or they might be looking away if they're talking about something uncomfortable. So it hasn't been a huge challenge in terms of the eye contact. In terms of the body language, I really prefer to have my clients at least be able to see this amount of them. But, sometimes they have their phone and they can just hold it up here. So you just have to kind of work a little extra hard to pay attention to what's going on with them, because you do lose a little bit of that.
Okay. Let's see. Got another question that came in that asks if you can... So Debbie was asking, I was moving too quickly through her questions. She meant to ask the name, but the name of the emotional assessment, the one that you mentioned used was the movement inside out.
Oh, sure.
What that was.
That is called Ekman's, ECKMAN, Ekman's Atlas of Emotions. That's the name of the website.
Okay. All right. And just from a quick production standpoint, I just, in dealing with video issues and cell phones and everything, one of the things that we use in our field a lot is a tripod called the GorillaPod, and it's like $49. You can put your cell phone right into it, and it stays stable.
Nice.
And the nice thing too is that you can move the legs around, because sometimes it gets shifting. So I just put a link to that if anyone's interested.
Oh, that's awesome.
All
yeah,
right.
you probably have some ideas there.
yeah, it's always an issue, right? Trying to get people to
yes
to the cell phone, because you get people walking around and zooming in and out, and it's a challenge.
And you hear a lot about lighting too, like what angle you want your light at, so that, we talked about that somewhat too.
Yeah, and one of the things with cell phones too, we find like a lot of times it's hard in your house to get good lighting. The best one is natural lighting. So if you're in front of a window that, unless it's super overcast, that's usually the best lighting you can get.
And is it true you want the light behind the camera?
Yeah, you want some light behind the camera. It's also, that would be good. Absolutely. Yeah, you want to face the light.
Yes, good. I have a professional here to
All right.
back me up with this.
You're trying, right?
Yes.
Okay, so Kathy says small picture frame placeholders work well for a cell phone. That's a great point too.
Nice.
Let's see. So as maybe Cindy, you could help us with one. Could you please type the emotions assessment website? And then
It's the Ekman's Atlas.
repeat the opportunity on October 28th on this topic.
Yes, hold on, I wrote it down, so let me grab my
Okay.
paper. Okay, so FATA, the Florida Alcohol and Drug Abuse Association, is putting on a webinar on October 28th it's called Professional Boundaries, Confidentiality, and HIPAA with Telehealth Services. So if you're with SMA, you got it in an email. They email it to everyone. And if you're not with SMA, you can look for it on the Florida Alcohol Drug Abuse Association website. It's FATA. I'm not sure if it's .org or .com, but I would just look it up and you'll find it. Okay. ECKMAN, and then I think it's apostrophe S, obviously, in the Atlas of Emotions.
The other thing too, we talked about privacy. I know one of the things too, one of the challenges, a lot of people start using their cell phone for the video, and now their ears away from the headset. So I think a lot of times too, if people use AirPods, if clients use AirPods, that can make a big difference, because then at least your audio is just between you,
yes,
and or at least the therapist audio is just between the two of you.
Yeah, and just make sure if they're not young and tech savvy or old and tech savvy, that you have some time to work out. I do have with the AirPods a lot of make sure your microphone and your headphones are set to the right setting. So that's a thing to think about that I've struggled with, especially the Bluetooth can be a challenge.
Oh, it's true if their Bluetooth is off.
Yeah.
Okay, so we'll give one final chance for questions here. If anybody has any, you can type them in the chat box. Really want to thank everybody for attending today. As we wrap up here, I also want to thank our sponsors. The SMA Healthcare Foundation is the main coordinator of all these webinars that are found within the webinar series. So We want to thank them. They've really stepped forward. They didn't let COVID stop them. A lot of people say, let's just cancel events and do them next year. The SMA Healthcare Foundation did the opposite. They looked for opportunities and creative ways to do this. So I really want to thank them for making it possible. Also the Jay's Hope Fund. They're a big funder of this project and a big supporter. Advent Health, of course, very into this program. Brown & Brown Insurance, E&M Pros, the Simpkins Family Foundation, SMA Healthcare Foundation itself, kind of the parent organization, as well as FP&L. All right. And don't forget again to download the presentation here. You'll be getting a recording early next week. Fill out your CE request form if you haven't done so. We'd love to get your evaluation back on this session as well as future topic ideas. So if you can fill out that'd be great. And if you can check out the SMA Healthcare Foundation website too. There's a lot of great resources, a lot of great programs. They're both based in Daytona, but I believe cover, is it 6 counties, Cindy?
4.
4 counties. And so they cover a lot of territory. And so great. So we got a lot of thank yous, Kelly. Comments here include thanks, great job, excellent presentation, enlightening, thank you. So any final words for our audience out there?
Any questions that come up, you can email me at kkraus, so my name, K. Kraus, at smahealthcare.org.
Okay. Well, thank you so much. This is a great presentation today. Thank you so much for everybody for attending. You'll be getting a recording, and stay tuned for future events from SMA Healthcare. It's a great